So my name's Joe. I'm one of the doctors with the Salivary Gland Cancer team at the Christie Hospital. My sort of actual role within that is as a clinical research fellow, so that involves both a clinical component where I see salivary gland cancer patients in our clinics, and then also I do a lot of my time is spent on research where I sort of work with the clinical data from those patients and our biobank sort of cohort as well. I think one of the main things that led me to being interested in salivary gland cancers is that it's a really rare type of cancer, and therefore there's a lot that we can learn about this cancer to help improve people's experience with it. And I think, for a lot of people it's very scary when they get a rare cancer. There's a lot less information out there, and it's really rewarding when you can help improve that knowledge base and experience of patients. So one of the main things that I'm focusing on researching at the moment is the quality of life in salivary gland cancer. So the amount of published evidence on quality of life in salivary gland cancers is very limited. And what we're working on at the Christie is to try and get a baseline from our cohort of patients to understand the general impact of quality of life. And this is really relevant for developing drug therapies, because even if a drug therapy is effective at stopping the cancer, if it causes a massive decrease in quality of life, then it can end up being as bad as the cancer itself. And vice versa, even if a drug doesn't slow the cancer down, if it has a significant improvement in quality of life, then that can still make the drug worth it for patients. Been really helpful to me as a research clinician because I'm able to hear a lot of different perspectives from patients that are different to what I can hear in the clinic setting. There's a lot of overlap with what patients tell me in clinic and what they complete on their quality of life questionnaires. However, this more informal setting means that they have a different perspective of what we'd get normally, and that's really helpful to get more understanding of what's important to patients in their salivary gland cancer journey.